Hi there, this is Albert from the TVASurg team, and this is my avatar in VR or virtual reality. Today we have a special presentation in virtual reality, and we'll be using some of the models that we've developed for the Video Atlas project. This presentation will be geared towards patients that are affected by Primary Sclerosing Cholangitis, or PSC for short. And this is a disease that affects the liver in the body, or more specifically, the bile ducts in the liver. In the past, we've used this format to engage with patients and families, and we found that be useful to understand the different organs and structures that are affected by this disease. So we'll start with a camera change to my point of view, and you'll see my hands interacting with the models as we go. So in front of us is a model of the human body, and just for orientation, this person is facing us, and this is their right side, this is their left side, and we can see all the abdominal organs in the middle here. I'm going to use my pointer here just to go through all of them. So on their right side, you can see their liver. Right next to that on the left side is the stomach over here. If you look in the back, that little purple thing there, that's the spleen. In the front here, peeking out here in yellow, that's the pancreas. In front here is the brown tube. This is the colon, or the large intestine. And right in the middle here is the small intestines. So we really want to focus on the liver, so I'm going to turn off a lot of these and just focus on that structure. I'm also going to make this a little bit bigger so you can see. So if we kind of flip the liver to the underside, you can really see, this area here with a lot of tubular structures going in and out of the organ. This area here we call the porta, and this is where a lot of these exchange of materials happen. If we look into the liver and kind of make this a little bit bigger, you can start seeing all those structures that were at the porta kind of branch into the liver there, and they're all color-coded in different colors, and we can go through them one by one. Fine. So I'm going to turn off most of this, and we'll talk about the red, which is the arteries to start. So the arteries carry oxygen-rich blood to the organs, and you can kind of see, if we look at the side here, this is the largest artery in your body. It comes from the heart and lungs with all that oxygen-rich blood, and it starts giving out branches to different organs. And you can see, if we switch back to the front here, there's a little branch here that goes up to the liver and then starts branching to the left side and branching to the right side. So that gives the liver all the oxygen it needs to perform a lot of the functions that keep you healthy. Now the liver is a little bit different from other organs in that it has another set of blood vessels that supply blood to it. You can see here in purple, this is what we call the portal vein. And these actually follow the arteries very closely. If you look at how it kind of runs to the left side here, and then into the liver, and it branches off into the left, branches off into the right. It follows that branching very closely. But in this case, it actually carries blood that's rich in nutrients. And what do we mean by that? I'm going to make this a little bit smaller. And then I'm going to bring back our stomach and small intestines. So just a quick kind of review, when we eat, food goes into the stomach here, and then it travels down into your small intestines, these loops here. And as they travel down, they're broken down more and more until their nutrients are released. And at that point, all those nutrients follow this purple portal vein here and goes into your liver through the branching as we saw before. The liver can decide what to do with this, all these nutrients. They can store it, they can process it, they can sometimes even detoxify them. A lot of things it can do, but they do need to be collected through this pathway. Okay, I'm going to make this a little bit larger now. So all this blood that goes into the liver needs to come out. It can't just be there. So this is what the blue hepatic veins are for. I'm going to turn these off so just we have a better look at these. And notice the branching is very different here. You see 3 main branches, a left branch here, a middle branch here, and then on the far right side you see a right branch over here. So all these branches do is collect all that blood from the red arteries, from the purple portal vein, and then they put it back into this really big tube in the back here. You can see maybe from the side again. So this really big tube, this is the biggest vein in your body. This is called the vena cava, and it connects back up to the heart, which it then pumps blood back to the lungs, gets it saturated with oxygen, and then it travels down the artery, the largest artery in your body, and then now that that blood is full of oxygen, it can again travel back to your liver and provide it with the oxygen it needs. So that's a nice little cycle of blood circulation within the liver itself. So that's it for the overview of the blood vessels, but I think what we really want to take a look at here is the biliary system in the liver. So I'm going to make this a little bit bigger so we can see. Right. So these are the bile ducts of the liver, and they're denoted in green. And one of the functions that the liver has, it makes something called bile. Bile is something that helps your digestion, and it gets collected in these really small ducts here. The small ducts kind of converge into larger ducts, like here. You can see it on this side as well. Smaller ducts collect the bile, and then they converge into bigger ducts. And we look at the porta again, looking this way. You can see that ducts exit, and then the bile ducts actually lead to this balloon-like structure here. This is called the gallbladder, and the bile actually sits here for a bit. It waits for a signal. Once that signal is triggered, this balloon actually squeezes, and then it all releases down this really big duct here. We call this the common bile duct. Now you might wonder, what that signal would be, and what is bile for anyways? I'm going to make the liver a little bit smaller, and we're going to bring back the stomach and the small intestines just so we understand. Remember, when we ate, the food goes into the stomach, gets turned around a bit, and as it exits the stomach and gets into this place, what we call the duodenum, the gallbladder contracts, bile travels through the common bile duct and enters the duodenum, and that actually mixes in with your food. So bile is actually a digestive kind of substance that your body makes, and when that mixes in with your food, it actually breaks it down, especially for fatty foods. It breaks it down, and then as it travels along your small intestine, it becomes smaller and smaller, more broken down, until the nutrients are released. And if we remember, the nutrients travel back up into the portal vein, and then into the liver again as it branches into the different lobes of the liver. So here's another nice little circulation. The bile is created in the liver, it goes into the gallbladder, waits a bit, and as food goes through the stomach, it triggers the gallbladder to contract. It would secrete the bile into the common bile ducts, into your small intestines, mixes in with your food. As your food goes down this loop of intestines, it releases nutrients, and nutrient-rich blood goes back up the portal vein and back into your liver, and your liver decides what to do with it. I'm going to turn this off, turn that off. Okay, I'm going to make this a little bit bigger, just so we can really kind of take a look at the bile ducts here. And I'm going to turn the liver off as well. Okay. In PSC patients, this looks just a little bit different. So I want to really make sure that you pay attention to this duct in particular. Right? So in PSC patients, the bile ducts kind of look like this. You can see in the orange, the ducts are a little bit ballooned up. And then in the pink arrow here, you can see the ducts actually really narrowing. And this is actually repeated along the duct here. You can see ballooning, narrowing, ballooning, narrowing. You can also see it on this duct, so you see some ballooning, some narrowing. This pattern, we call this the beads on a string pattern. And this is really common to see in PSC patients. Sometimes it also happens on this big duct here, the common bile duct. You can see it here. So in the purple is the narrowing, and then the orange is the ballooning. And that kind of happens along the length of the duct as well. I'm going to bring back the liver. I'm going to shrink this down a little bit. And the reason this could become a problem is with all the narrowing portions in your bile ducts, bile can't really exit your liver that well. And that's a problem because if bile stays in your liver too long, it actually starts damaging the liver, the cells in the liver. And this is because bile on itself, remember, it's used to, it stays in the gallbladder, but then it's secreted into your small intestines. It has properties of soap or detergent. That's what makes it really well at breaking down some of your foods, in particular fatty foods. And if that substance stays in your liver too long, it actually starts damaging the cells. And in certain cases, it actually impairs the liver function in certain ways. And this can lead to various symptoms of what PSC patients would experience. So thanks again for joining us. We hope that has been useful for understanding PSC and its effects on the body. If you're a PSC patient or you know someone that has PSC, please do let us know if there's other topics that we can explore in this format. And thanks again for joining us.